Greetings, everyone. I'm Gertie Loretta Hurley, founder and CEO of Taking Effective Action. And we're blessed today to have Ms. Angela White, a licensed social worker and founder and president of Infinity Mental Health, LLC, which is in Upper Marlboro, Maryland. Greetings. Hi, how are you doing?
I'm well. Thank you so much for having me.
Oh, I'm so glad you could take time out of your busy schedule to just give us a few minutes on how we can cope right now with stress and like how does the stress affect heart health?
Some of the general causes of stress are life transitions. So it could be moving to a new job. It could look like losing a loved one. Moving cause a lot of stress, changes in our family, whether we're having a new child, getting married, getting divorced. A lot of adjustments and life transitions sometimes cause stress as we have to transition how we see things and also our role.
In terms of the heart and the connection, what can we do about avoiding stress so it won't damage our heart?
So the connection with stress and our heart are called physiological symptoms because we cannot see stress, but we can see the impact of our heart on EKG. We can see what that physical response looks like. So when we're not taking care of ourselves, when we're missing meals or not getting the right amount of sleep because we're stressed out or overworked, that impacts how our body's able to function, how our heart is pumping. So when we are stressed, sometimes our self-care decreases, which increases the chances of us having more complicating factors, which impacts our heart.
Okay, this is Black History Month this month, and stress causes a lot of chronic illnesses. Marginalized groups, they react a little more, they react differently from just the regular mainstream population in chronic. So what kind of advice would you give for us?
Specifically looking at our own community, starting with being open and willing. A lot of times we hear that we're the last ones to go to the doctor when we feel pain or we feel some different feelings in our body. Being open to, making sure we have the preventative care of seeing our doctor for our annual visits or follow-up visits. That also includes mental health. If we're feeling stressed, who are we reaching out to for our mental health? Who are we reaching out to for our spiritual health? Sometimes that may look like our pastor or our church leadership. In our community, sometimes we have trouble receiving help. So understanding that we cannot do it all, and that's okay. We have professionals in our environment to help us with hard times, to help us with challenges. If you need community resources, those are available. If you need to reach out to your insurance provider for support in finding resources, that's an option available to us. We are normally the last ones to seek medical help, which also in turn gives us more complicating factors for our medical conditions. So I would really encourage us to take those steps to getting primary care, to seeing those specialists, to taking the medication, getting those follow-up visits done.
Oh, that's really great advice. So we've talked about the causes of stress and we've talked about the link between stress and the heart and some of the chronic diseases. Now, what are some of the ways to reduce stress?
There are many ways to reduce stress. One of them is really checking in with ourselves about how are we feeling, reflecting on our emotional capacity, reflecting on our physical adjustments. Have I noticed that my heart is beating much faster right now? Have I noticed that, maybe I'm having sweatier palms or my legs are jittering? When you notice those things, check in with yourself. Maybe sometimes take a big, deep breath, inhale and blow some of that out, but also increasing our self-care practices, which could look like going for a walk, taking some time to sit outside, calling a friend for support. I said before, seeking out your spiritual advisor, talking to your pastor, taking some time to read, following your hobby. There are many different practices that we can do for self-care, and it really does mean just caring for ourselves, taking that time to focus on what we need in this moment. Do I need to just sit and meditate for 5 minutes? Do I need to say a quiet prayer? Do I need to get some physical energy out, get some physical exercise? Or do I need maybe have a healthier meal? That is also a form of self-care, focusing on our nutrition.
Oh, and that leads me to segue to some healthy ways. How can we have some healthy ways to cope with this stress.
Specifically to the times that we're in right now, as we're in a pandemic and there's so much information coming to us that can increase our stress, looking at ways to decrease and real strategies. Sometimes it looks like limiting those negative inputs. So if we have some friends that are always gossiping or kind of always bringing us a little bit of drama and chaos, limiting that connection, increasing the focus on our nutrition, on our sleep, making sure we're getting adequate sleep. It is recommended to get 7 to 9 hours of sleep every night. Sometimes we do have to turn the TV off a little bit earlier than anticipated to make sure that we're able to sleep so that our bodies can function in an optimal level.
Now, I know that being a professional, you still have a busy life, especially during these days. So, what do you do, Ms. White, to manage stress?
Thank you for asking. Well, with like I said about the pandemic, I've actually had to relook at how I practice self-care. For a while, gyms were closed. We couldn't go to the gym. So when it's nice outside, I can go for a walk and get the sun on my skin, get the breeze of the air. I've also taken up gardening. I really love plants and the time that it takes to cultivate your plant. You actually have to look at your plants. How are they looking? Are the leaves turning yellow? It takes a lot of intentional practice to take some time out and be present with my plants. So I really do enjoy gardening, become one of my favorites, as well as meditation. So having that quiet space in your mind, it doesn't have to take a long time. You really can start with 5 minutes, but just taking that time to quiet my mind is life changing.
That's wonderful. And a lot of us can really learn from that and try it. I know I have plants. I don't have a garden, but I have plants in the house that I talk to the plants.
Hmm.
And it really is, it's a blessing to me. And I would say if anybody has a jacuzzi or even a tub, that a nice soak is good for you.
Yes. With the warm, that it touches all of the senses. Sometimes even having some essential oils
Right.
to have that, lavender in it to help soothe your body and your mind.
Thank you so much, Ms. White, for joining us today and giving us all this valuable information. Thank you so much. We enjoyed having you here as a speaker today. Thank you.
Thank you so much for having me, Dr. Hurley.
Okay, bye-bye.